Well, we've been watching the cozy relationship between the biopharmaceutical complex and Washington, D.C., the power center of the United States. And nowhere is that on greater display than with Dr. Peter Hotez, the doctor whose name is now being floated as the replacement for Dr. Fauci. Last night, in part one of his investigation, Dan Cohen showed us the sordid history of Dr. Peter Hotez and his relationship to the power center of Washington and Bill Gates and the federal government at large. Dan Cohen joins us now for part two of his investigation. Dan, welcome back. Part one was absolutely eye-opening. What have you got in part two?
Good to be back with you, Clayton. So in the first part, we saw how Peter Hotez, from the very beginning of his career, has been sponsored by Big Pharma and his collaboration with the Gates Foundation and the U.S. government to spawn a neglected tropical disease complex, which meant just testing novel pharmaceutical products on third world countries. And that was the case for decades. And so in part two, we're going to see how basically that same paradigm was turned inwards in the COVID era. So let's go ahead and watch part two. Peter Hotez has built a career in the nexus of pharmaceutical giants, billionaire foundations, and the U.S. government. In the COVID era, he has become an evangelist for the emergent biomedical security regime, attacking anyone who deviates from its diktats.
We have to recognize that anti-vaccine activism, which I actually call anti-science aggression, anti-science, anti-vaccine aggression, anti-science is now a leading cause of death. It's killing more Americans than gun violence, nuclear proliferation, or cyber attacks.
Hotez posits that resistance to novel pharmaceutical products is a white supremacist plot that springs from the Republican Party and is taking over the world.
The most vaccine hesitant group in the United States are what are being called Republicans. Some polls call it white Republicans. It's somehow married now to far right-wing extremism and white nationalist groups, not confined anymore to the United States. It's happening across Europe. Now you're seeing the disinformation go into Africa and elsewhere. This is now a full-on globalized anti-science movement.
These forces, he says, are supported by Vladimir Putin.
The Putin government has, this has been reported by U.S. and British intelligence, has been piling on with this whole systematic program of what's being called weaponized health communications. Weaponized health communication through their bots and trolls, trying to destabilize democracies with anti-vaccine, anti-science messages and targeting scientists.
To counter this, he has proposed a series of measures. First, for so-called anti-science to be punished as a hate crime, saying both existing legislation be extended and new protections created. He's called for the U.S. government to censor what he calls anti-science terrorist groups.
I've been having discussions with the federal government for many years now. Is we've got to do something about it. Take this down and create an interagency task force.
Use the full power of the U.S. federal government to see what levers are available.
We need help from Homeland Security. We need help from the Commerce Department, from the Justice Department, and the State Department.
Get it off of the cable news channels and the far-right podcasters.
We need to do something more aggressive. Have to go into that dark place.
The UN, WHO, and NATO, he says, must join this censorship effort.
I mean, it's a demonization of very credible people who are actually expert at the science of vaccines and have developed appropriate questions and concerns, and he dismisses them as an enemy, and he calls upon even security agencies to coordinate and go after these people who are actually practicing science.
When somebody like this not only wants to deny the science, but wants to put people like me in jail and make us lose our license. This is a true sociopath. This is German-level sociopathy.
He has called for governments and international bodies to carry out a counteroffensive.
Let's talk to the people who know about cyber attacks, who know about nuclear proliferation, who know about global terrorism. There might be some tools there that we can use to fight this anti-science aggression, because I believe it's reached that same level.
And written that they must take direct, even confrontational approaches with Russia. He even called for a CDC coup against the executive branch.
If we've basically decapitated the leadership of the government in order to run COVID-19 response, who can step up? Can the CDC do it?
If we don't have a federal government, if we don't have the White House or the executive branch of the government engaged in doing this, do we have other options? Are there levers Congress can push? I think we have to start looking at this.
Hotez consistently cites the U.S. government, its intelligence cutouts, and proxies. His claims about Russian interference cite a dubious report from Noveta, a contractor for numerous branches of the U.S. military, owned by a firm called Accenture, which is tied to U.S. intelligence and the World Economic Forum.
Is Peter really fully independent? Is he acting as an independent agent in good conscience and academic? Or is he deeply tied to the deep state and the intelligence community?
His censorship efforts have been abetted by the Anti-Defamation League.
And with that anti-science aggression goes hand in glove with anti-Semitism.
The ADL, ostensibly a hate monitoring group, is primarily an Israel lobby outfit known for conflating criticism of the state of Israel and support for Palestinian rights with anti-Semitism. In the COVID era, it has sought to conflate skepticism and criticism of novel pharmaceutical products with anti-Semitism.
COVID has led to a new form of variant of anti-Semitism.
These censorship efforts have had some successes. When Instagram suspended Robert F. Kennedy Jr., Hotez praised it as the first time that Facebook/Instagram has taken a step towards dismantling the anti-science empire, and that hopefully this is only the beginning. In September 2021, Houston, Texas resident Marissa Hansen interrupted Hotez during an appearance at the Congregation Emmanuel.
I'm sorry, but I have to interrupt. Dr. Hotez, I know about the children that have died from the Pfizer vaccine, and it's your job to not deny that. It's not a hate crime to question science. You understand that. I will leave now.
It's not unusual. Actually, she was quite well behaved, so we have to be thankful for that.
In response, the congregation's rabbi banned her for life. While Peter Hotez demands censorship and international action against foreign countries, he has contradicted himself at virtually every turn throughout the COVID era. In the first year, when Trump was still president, Hotez warned about the dangers of rushing vaccines under emergency use authorization.
I don't think EUAs have a place for vaccines.
We've never done an emergency use authorization for a major vaccine released to the public. What does that mean? We know it's a lesser quality review. What's the FDA going to do to ensure public safety?
While Hotez may have had political motivations to cast doubt on the coronavirus products, he had good reason to be concerned. In March 2020, Hotez gave congressional testimony to warn about the dangers of coronavirus vaccines.
One of the things that we're not hearing a lot about is the unique potential safety problem of coronavirus vaccine. With certain types of respiratory virus vaccines, you get immunized, and then when you get actually exposed to the virus, you get this kind of paradoxical immune enhancement phenomenon. We started developing coronavirus vaccines, and our colleagues, we noticed in laboratory animals that they started to show some of the same immune pathology that resembled what had happened 50 years earlier. So we said, oh my God, this is going to be problematic.
While Hotez warned against fast-tracking a vaccine, he was appointed by Anthony Fauci to lead an NIH program with pharmaceutical executives, the Gates Foundation, and others that did exactly that. In May 2020, anticipating public concern about what he had admitted was rushed testing, potentially unsafe products, and a new platform, Hotez wrote that the communications and missteps around the rollout of COVID-19 vaccines may require a period of damage control, and called for the White House and NIH to shape a well-crafted vaccine communication plan and designate a trusted spokesperson who can articulate and carry the message, an apparent reference to himself. Once the FDA had given emergency use authorization, Hotez reversed his public stance.
So what's your reaction to this approval out of this second vaccine?
It's fantastic. The emergency use authorization closely approximates the full approval process, so there's nothing really rushed. Any vaccine released by emergency use authorization by the FDA is an outstanding vaccine. Take whatever vaccine is really offered to you.
Hotez said that once enough people were injected with 2 doses, viral transmission would stop and other measures would no longer be necessary.
News is good. It's saying even after 6 months, it still looks like it's really strong and durable. So this is going to be a long-lasting vaccine. A single dose is not very effective, but 2 doses fully vaccinated people are.
A week or two after the second dose, the masks can start to come off.
And guess what? You can have everything you've asked for in terms of not requiring social distancing and masks. We can have an extraordinary quality of life. This is time limited.
It's not in perpetuity, Wolf.
This is not in perpetuity. We are going to vaccinate our way out of this epidemic starting in the summer. If enough Americans get vaccinated, we could actually halt virus transmission, potentially.
If you do the simple math, I did a back of the envelope calculation.
Once you get over 65% of the population with a single dose of the vaccine and 50% with 2 doses, the amount of transmission will really start to decline.
60 to 70%, 60 to 80% threshold.
We need to get to about 75% before we interrupt transmission. Around 3/4 of the U.S. population.
Roughly 80% of the U.S. population.
2 doses turned to 3.
I think ultimately a third immunization with the mRNA vaccines will probably be needed at some point.
We thought there was a pretty high likelihood we might have to give a third immunization down the line anyway at some point, because we had no idea about the durability of any protection of any of these vaccines.
So if you got a 2-dose Pfizer Moderna vaccine, think of it as a 3-dose vaccine. We ultimately will need to give a third immunization, and I've been pretty much saying that all along. This was always a 3-dose vaccine, and so this was all predicted and predictable. I've always said this is a 3-dose vaccine. 2 mRNA vaccines were always a 3-dose vaccine. We've known for a while that this was going to be a 3-dose vaccine. The big unknown is what happens to those of us who got 3 doses. I don't have the answer. You need that third immunization to get a 30 to 40-fold rise. After you get that third immunization, you do get a big boost in virus-neutralizing antibodies.
By November 2021, the U.S. population had met what Hotez and the government called fully vaccinated.
Today, we hit 2 important milestones. 80% of adults now have at least their first shot, and 70% of adults are now fully vaccinated.
But the goalposts were shifted, and the booster campaign was just getting started.
And we're going to have to change the definition of fully vaccinated. What counts as full immunization will be 3 doses just because we gave those first 2 doses so close together. The idea that 2 immunizations constitutes full immunizations is not even close. You need that booster, and you probably need the second booster. If you've gotten a single boost and you're eligible, get your second boost.
The solution here is just continue mass vaccination as aggressively as possible?
That's right.
Are you expecting, as a result, for these vaccines to essentially become a twice yearly thing?
Of course, with mRNA, that may be what's required. You need 2 boosters. You're going to need a third booster. 2 boosts really makes the difference. Get your second boost.
There are these new boosters. They've been available for a little over a week. Who should get them?
Well, anyone who's eligible. Once you're more than out 4 or 5 months from your last booster.
No matter where you're at, maximize out your vaccinations. And even if you've gotten a single booster, you need 2 boosters.
Now's the time to get a booster if you haven't been boosted in a while.
2 to 4 months out, you're going to need a third booster as well, a 5th immunization. Third boosters, meaning 5th immunizations, new bivalent booster. You want to get Paxlovid. That gives you an extra layer of protection as well. You need to get that booster. People need to get their bivalent booster. And
the important message that I have this morning is get your new bivalent booster. If you've not gotten it, you have to get it.
They're talking about the third shot. And is that the bivalent, or is it the 4th booster, or does it matter? Like, can you help me understand?
So before Elise was asking me that very question, I said, don't worry so much about the number of boosters. Worry about when you got your last booster.
Okay.
Attempting to boost ourselves out of this pandemic is, in my opinion, the immunological equivalent of heroin addiction. Okay, and what I mean by that is that we're trying to get we're trying to squeeze more and more benefit, but which we're not getting. We're getting less and less benefit for more and more risk of side effects. The more doses, the worse it gets. So this is counterproductive. It's not just that it's not working; it's counterproductive.
When Johnson & Johnson's product was pulled after causing blood clots,
the J&J vaccine does cause a rare serious event, cerebral thrombotic event.
Hotez continued to push them.
Well, I don't have concern about the vaccine. It's a good vaccine. It's an excellent vaccine.
After years of blaming the unvaccinated for the virus, demanding censorship, and seeking to criminalize criticism, Hotez casually admitted that the injections, in fact, don't stop transmission.
We are not stopping infection anyway, but no, the booster's actually keeping people out of the hospital. And so
I've never seen such an unabashed pro-vaccine cheerleader who never talks about all of the concerning and immense amount of data showing that this is a failed vaccination campaign. This is not a scientific man. This is a political animal.
When the mRNA shots failed again and again, it was a perfect opportunity to market his product.
A vaccine that's now been given to almost 20 million kids in India, and looking along something along those lines, I think has to be on the table.
And that's the vaccine that you worked on?
That's right.
Some people call it people's vaccine for the world.
We need a simpler technology that we could scale for the world, and that's what we're doing. And we think this could be the vaccine to finally vaccinate the Southern Hemisphere.
After having been shelved years before, Hotez's product was kickstarted with funding from the JPB Foundation, created from the wealth of the late Jeffrey Pickauer, who made $5.1 billion in the infamous Bernie Madoff Ponzi scheme. In December 2021, Hotez got his wish as the Indian government gave emergency use authorization to his Corbevax product. But in April 2022, after 30 million adolescents had been injected, it was revealed that the Indian government had broken its own testing protocol and ignored the concerns of its top regulatory body. Instead of pulling the product, its emergency use authorization was expanded to include even younger children. By the fall of 2022, 70 million Indians were injected. Botswana and Indonesia have since approved it too. Throughout his career, Hotez has been careful to align himself with Anthony Fauci and speak warmly about their relationship.
Tony, who's a friend and like big brother to me for decades.
I understand what Tony's going through.
If anybody could do it, it's Dr. Fauci.
It's not just Tony, it's myself.
Dr. Hotez has functioned as a sycophant to Dr. Fauci all the way through this. He is willing to say whatever Dr. Fauci wants and has been a clear participant in the government propaganda campaign that we've all been subjected to.
With Anthony Fauci having retired from the top U.S. government medical position, Hotez, a Fauci underling willing to suit his expertise to powerful interests, is a natural fit to replace him.
Peter, I think, has long been seen as someone who's been groomed to take Tony Fauci's position when he should finally retire. And during the COVID crisis, I'm afraid that this has really kind of gone into an accelerated mode.
No matter what, Hotez says another coronavirus is lurking around the corner.
COVID-19 is the third major coronavirus pandemic of the 21st century. We had SARS, MERS, now COVID-19. A fourth one is brewing. I can guarantee you right now, coronaviruses are jumping from bats to people every day, and it's a matter of time before it catches fire, and we have a fourth major coronavirus pandemic. And that's going to be another major issue in a few years. So absolute death and destruction by
Wow, just absolutely eye-opening to see in part one just this decades-long influence here. It seems like, Dan, his whole career, he's been manipulated. He's had the strings. He's like a puppet. He's like a marionette, I guess. Like he's been controlled by this complex, and he's been a willing participant for decades in this.
Yeah, he's obviously benefited massively from his connections to literally the most powerful forces on earth, from Bill Gates to the U.S. government, Dr. Fauci, who he considers a mentor. But I mean, when I look at Peter Hotez, first of all, we have to understand that he is a liar. I mean, we saw him flip-flop on emergency use authorizations, and that was clearly a political move. We saw him say 2 doses of the COVID shots are great and offer long-lasting protection. And then suddenly, without explanation, it became 3 shots. And I think it's going to be 3 shots. And then it became, I've been saying 3 shots all along. And then it became, we have to change the definition of fully vaccinated and boosters and more boosters. And then even Mika Brzezinski, when it became, how many boosters am I supposed to get exactly? It's don't think about the number of boosters, just get more boosters. So he starts to sound like a used car salesman. I think, it's just obviously he's such a shill for big pharma, but it's even worse than that because he's actually dangerous. Look, Peter Hotez knows what antibody-dependent enhancement is. He knows that these vaccines, these so-called vaccines, which really aren't vaccines, can actually make the virus worse. The infection worse. They can backfire. He knows about original antigenic sin, that when you get the first one, then your body is unlikely to produce antibodies to fight later variants. He knows all of this stuff. He can explain it far better than I can. He is a real expert. But the thing is, he chooses to not tell people about the risks, which he admitted there are when he's testified in Congress in 2020. He chooses to not tell people about the risks of these injections. And then the people who are skeptical, he wants to throw them in jail. He wants to take doctors like Pierre Corey and David Weissman. He wants to strip them of their licenses, their ability to practice and research and conduct actual science, and throw them in jail. And people who are skeptical, families, parents who are saying, well, maybe I don't want my child to be a human pincushion for Bill Gates. Well, those people should be locked up too. DHS needs to track them down and hunt them down, and NATO needs to go after them. This is a man who, as Pierre Corey said in the video, he is a political actor. I mean, we saw him for an actual coup against the executive branch. That is not medical. That is purely political. So, I mean, in the video, you see that he's tied to the deep state. He's basically an agent of the deep state. He cites U.S. intelligence. It's like the biomedical version of like Russiagate, of all of those complete frauds. That's who Peter Hotez is, and he loves power. When that part where we see he's at the synagogue in Houston, and that young woman, Marissa Hanson, politely interrupts. She gets banned, and you see that he just loves that little taste of power. So, I don't know what happened to him as a child, but this is a man who needs therapy. The idea of him being in power, of replacing Dr. Fauci or something like that, is terrifying. If Hotez actually gets appointed to replace Fauci in their confirmation hearings, I hope that these videos, these reports, these investigations that we've done can be used to show what a completely dishonest and dangerous man this is. So this is someone who should be nowhere near power.
And yet his name is at the top of the list for a possible replacement for Dr. Fauci. Unbelievable. But this is our federal government. This is how things are done in Washington. Dan, we really appreciate it. Great report. Thank you so much for joining us on this. We will keep our eyes on this story as it develops. Dan, thank you so much.
Thank you.
And Charlie Skywatch here in our chat just says that we have to get rid of these evil creeps. Yeah, I mean, the only way, knowledge is power. And by, sharing these videos out, by just clicking on the like button and sharing it, click the little share button and send it to a friend, someone who doesn't understand what's been happening over the past 2 years, what our federal government has done to us. What an operation this has been, both at the Department of Defense level as a military operation on COVID, and these clowns who are profiting handsomely through the biopharmaceutical complex.
Right.
As Dr.
Well, and when you took those news stories and compiled them together like he did, it felt like an actual infomercial. I felt like I was watching an infomercial from the pharmaceutical companies.
You just need one shot. You just need two. Now you need two. Now you need two. Now you need three. Now you need three. And then Miko's like, well, how many shots? How many numbers? How many numbers?
Right.
5. Give me 5.
Give me 5.
Do I have 10? 10. Do I have 10? Do I have 15?
And she said 3 shots. And then he said, no, don't worry about the number anymore. Let's just not even think about the number. Go ahead, Philip.
I was going to say the only thing missing was the news anchor, like in black and white, fumbling a syringe or something like that, like having trouble like getting your own vaccine.
Right. It is like an info. Having trouble getting your own vaccine and you're just flopping around. Never mind. Dr. Peter Hotez is here. He'll show you how to get in a vaccine. So unbelievable. So thanks to Dan for that. Thank you so much for watching this segment here at Redacted. We are live every day at 4 p.m. Eastern time, trying to share the stories that the mainstream media will not cover. You should also come over and join our community of Redacted Rebels over at redacted.inc. That's our private locals community where we can share exclusive content that we simply cannot share here on YouTube. Come over and join the rebellion together right now by going to redacted.inc. We'll see you next time.